As a first responder, you often arrive at scenes where urgent medical transport is needed. When there is not enough time to transport the patient to the nearest appropriate medical facility by ground, immediate air transport may be the most appropriate option. While air transport does come with additional risk and expense, it can be a life-saving intervention when it's indicated and if it's activated quickly and managed correctly. You can reduce the risks of air transport and increase its effectiveness when you know how to select and prepare an appropriate landing zone. Communicate clearly with the air crew and properly assist with patient loading. There are no universal indicators for when helicopter EMS should be employed. Each region or other jurisdiction has its own specific rules. Knowing these indications enables you to activate an air crew at the first sign it's needed. Generally, helicopter transport is indicated for certain types of injuries, mechanisms of injury, and scene conditions. Helicopter transport is also indicated when ground transport is not an option. As soon as you know helicopter EMS may be indicated, notify the appropriate dispatch center immediately. Early activation allows the closest and most appropriate aircraft and crew to respond safely and effectively. If an activated crew is later canceled, little is lost, while much might have been gained from early activation. A single person should notify and communicate with dispatch regarding the need for air transport. Usually, this person will be the incident commander or IC, unless a separate landing zone coordinator has been designated. When contacting dispatch, the IC should always specifically request the nearest available helicopter crew. Once an aircraft has been dispatched, dispatch will notify the IC of their arrival time window. This information should be communicated to the entire incident crew immediately, so that preparation for arrival can begin. Once an aircraft is on the way, the incident crew should select an appropriate landing zone, identify and mitigate hazards, and communicate details of the LZ to the air crew. An appropriate landing zone meets 3 criteria. It must be sufficiently large, free from hazards, and flat enough and solid enough to support a helicopter. The LZ should be 100 feet by 100 feet, day or night. There are 2 types of hazards: ground hazards and aerial hazards. Ground hazards include stationary objects and those that may become airborne. Examples are rocks, stumps, flares, objects potentially hidden in tall grass, and any loose flat debris that could act like a wing in the helicopter's rotor wash. To identify hazards effectively, think like a helicopter pilot. Aerial hazards include birds, poles, wires, trees, bright lights pointing into the air, and high velocity or gusty winds. The LZ must be flat enough and solid enough to support a helicopter. The stability of the LZ must be carefully determined as well. Sand, loose dirt, and snow are all potentially unstable ground types. Even the most stable ground should have as little slope as possible, usually less than 5%. Once the best acceptable landing zone has been identified, the ground crew should mitigate any hazards, physically remove any hazards within the LZ, and safely modify or mark any that cannot be moved. Wet down dusty areas and pack down snow. Remove all loose debris, especially any that could become airborne. Emergency service personnel must be at least 100 feet away while the helicopter is landing, and spectators must be at least 200 feet away. The helicopter's approach path must be clear of all vehicles, equipment, and people. Flares are a fire hazard even in the best conditions, and should never be used to designate an LZ because of the helicopter's rotor wash. If flares are being used nearby for traffic control, they should be extinguished and replaced with other markers. If hazards cannot be moved or modified to become non-hazardous, make sure to mark them clearly. For example, wires from electrical towers or telephone poles should be marked by parking an emergency vehicle beneath them with the overhead lights turned on. When this is not possible, shine lights or park vehicles near the poles. However, never shine lights on the wires themselves. It is ineffective and creates a visual hazard for the pilot. Always clearly mark the LZ and the wind direction with the best resources available. When possible, use non-flammable lights to mark each corner of the LZ and the direction from which the wind is blowing. Emergency vehicles may be used if no other lights are available. Make sure that the IC knows the latitude and longitude of the landing zone and is familiar with the relative compass directions. The IC should also be aware of all hazards that could not be fully mitigated, so that they can be communicated to the aircrew on approach. When the aircraft is 2 to 4 minutes out, the IC will be contacted directly by a member of the aircrew. The IC must be ready to provide the following information: the patient's condition, wind speed and direction, and ground conditions even if they have been partially mitigated. For example, inform the aircrew if an LZ is dusty, even if it has been wet down. The IC should also communicate to the crew about aerial or potential aerial hazards, latitude and longitude, and any other information that will help the pilot know the specific location. When speaking with the aircrew, the IC should always refer to absolute relative compass directions to avoid any misunderstandings. When that's not possible, refer to clock directions relative to the pilot. For example, there's an electrical tower at your 10 o'clock. Also, be aware of and inform the aircrew about additional aircraft in the area, especially if other helicopter EMS crews are en route. Accurate communication helps ensure that the helicopter is able to land and take off quickly and safely. Always follow 4 basic elements of helicopter safety during its approach and landing. Secure any loose items prior to approach. Never chase items that blow away. Protect your eyes and ears. And keep your head low. Once the helicopter is in sight, the IC should help guide the helicopter to a safe landing by standing on the edge of the LZ with arms outstretched toward the center of the LZ, back to the wind. If there is a marker showing wind direction, that is the best place to stand. During landing operations, the IC should be prepared to call off the landing if necessary. After the helicopter has landed, especially in critical incidents, it's tempting to begin immediately moving the patient toward the helicopter. While speed does count in rescue operations, and while it is especially important to activate helicopter EMS as soon as air transport may be indicated, approaching a helicopter is not the time to move quickly. Wait patiently for a member of the aircrew to leave the rotor disc and approach you. Never enter the rotor disc unless under the direction and while being escorted by a member of the aircrew, even if the patient is critically injured. Loading the patient into the aircraft is the aircrew's responsibility. While first responders will be called on to help in this effort, loading should never be initiated by anyone other than a member of the aircrew. There are multiple types of helicopter airframes, including those with side load and rear load doors. For all types of airframes, the same principles of helicopter safety always apply. When directed by a member of the aircrew, and only when escorted, assist in patient loading by following directions precisely. Approach and leave the helicopter frontally at a 90-degree angle from the doors, from a position where you can maintain eye contact with the pilot. Never under any circumstance approach a helicopter from the rear. If the airframe has rear load doors, the aircrew will escort you to the helicopter from the front and then along the airframe to the rear. Once the patient is loaded and the helicopter is ready to lift off, check again to ensure the departure path is clear of vehicles and spectators in case the pilot must make an emergency landing. The air-ground communication channel should remain clear from all unrelated radio traffic until the pilot has called clear. Only then should the IC announce that it's safe for personnel to re-enter the area formerly designated as the LZ. Early activation is important to maximize the life-saving potential of helicopter EMS. At the first sign that air transport may be needed, notify your dispatch center immediately. To ensure that helicopter operations are handled as safely as possible, identify an acceptable landing zone that is large and stable enough for a helicopter to land, and one with few hazards. After selecting a landing zone, identify all ground and aerial hazards, mitigate as many as possible, and mark the rest. Also, make sure that the single point of contact on the ground is able to clearly and accurately communicate all necessary information to the aircrew. While the aircraft is on the ground, when and only when directed and accompanied by a member of the aircrew, approach an aircraft from the front with your head low and eyes protected. Emergency helicopter transport can help you and your crew save lives. You can help it be as effective and as safe as possible by learning these key principles and acting according to them every time. For more information, to receive additional training materials, or to schedule a training event, contact your local CALSTAR base today.